Hello everyone, I am Ishani, presenting author of this study. The study is on adequacy of macro and micronutrition among the male national basketball players during the competition season in Sri Lanka. Many factors impact on sports performance, including macro and micronutrition supply. Poor dietary intake could be some reason for the national basketball players' inability to win at international tournaments. The study is aimed to examine the dietary intake of the national basketball main players during the competition season and to evaluate the adequacy of macro and micronutrition intake. The sample was 30 basketball players and the data gathering technique was 3 days data to recall and the data analyzed by food composition tables and NutriSurvey software. When it comes to the result, the mean energy intake of the participant was 3017.1 kilocal against the mean estimated energy requirement of 3448.7 kilocal. The table 1 describes the macronutrition content. The percentage of carbohydrate, protein, and fats were 58, 19, and 23 respectively. The table 2 describes the micronutrition content. The daily intake of vitamin D was 0.0125 grams and vitamin E was 4 micrograms. Finally, there is a significant deficit between energy intake and energy out, but estimated macronutrition are within the acceptable macronutrition distribution ranges and all the national players consumed adequate amount of micronutrition except vitamin E and vitamin D during the competition season. Thank you.
Honorable Chairperson, I am here to present the findings of my research study titled Biological Markers of Cigarette Smokers and Their Relationship with Smoking Status. Smoking is a major cause of mortality and morbidity worldwide. Assessing an individual's smoking status is important in healthcare settings. Biological markers such as exhaled breath carbon monoxide and fractional exhaled breath nitric oxide can be used to monitor the level of smoking. Objective of the study was to determine the level of smoking biomarkers among smokers and non-smokers and to determine the association of these biomarkers with smoking severity. Study design was a descriptive cross-sectional study and the settings were peri-urban areas of Colombo district. 360 male daily smokers aged between 21 to 60 years and matched non-smoking males of 180 subjects were participated for the study as the comparison group. Study tools, smoking severity was estimated by the Brinkman index and ECO levels and pheno levels were measured by Smokalizer and no-breath pheno monitor. Results of the study, the smoker's median daily cigarette consumption was 4 cigarettes per day, the smoking duration was 21 years, and Brinkman index was 80. Regarding the biomarkers of smokers and non-smokers, ECO levels were significantly higher and pheno levels were significantly lower compared to the non-smokers. Correlation of smoking variables with carbon monoxide and pheno levels of smokers, number of cigarettes smoked per day, duration of smoking, Brinkman index were positively correlated with carbon monoxide levels and negatively correlated with pheno levels, as well as the time lapse from the last cigarette was negatively correlated with the carbon monoxide levels. In conclusion, the measurement of the smoking through the assessment of ECO levels and pheno levels can be objectively used to assess the smoking status. Thank you.
I'm Navina Somvikrama. Welcome to our presentation on distribution and health-related quality of life of multimorbidity among parents of medical students at Faculty of Medical Sciences, University of Sri Jayawardenepura. Multimorbidity is defined as the coexistence of two or more chronic conditions in the same individual. Epidemiologic transition and demographic transition has resulted in increasing prevalence of multimorbidity. We conducted a descriptive cross-sectional study using convenient sampling of 85 parents of medical students. Self-administered online questionnaire was used and medical students filled it on behalf of their parents. Questionnaire consisted of 3 sections: socio-demographic and lifestyle factors, clinical information, and SFL questionnaire. Results of our study. Majority were females. Most common chronic disease was hypertension, followed by diabetes and hypercholesterolemia. The leading chronic condition among males was diabetes and among females was hypertension. Majority had two diseases. There was a significant association between number of diseases and physical component score. Lower physical component scores were associated with higher number of diseases. There was no statistically significant association between mental component score and number of diseases. Conclusions of our study. Most frequently occurring chronic diseases in multimorbidity are hypertension, diabetes, and hypercholesterolemia. Physical quality of life is affected with the increasing number of chronic diseases. Thank you.
Welcome everyone, I'm Antenatal and today I'll be presenting on the topic Design of a System to Analyze the Interface Pressure in the Boston-based Treatment for Adolescents Idiopathic Scoliosis, in short, AIS patients. AIS is a condition of three-dimensional change in the vertebral column's appearance. Cobb angle, which you can see here, is a standard measurement to determine this condition. Bracing treatment is the most effective treatment for correcting the degree of Cobb angle and reducing the curve. The importance of doing such a research came up due to some problems, such as that the redesigning process of the brace with the curve correction and the tightness level of the brace are subjective decisions, and also patients may not put the brace back at the same pressure after removing it. So that our aim of this study is to design a sensor-based system to measure the change in the interface pressure with the change in curve severity according to the type of the curve and different postures. In this study, the forces acting through the brace on the body during 6 different predefined activities was measured using a sensor-based module. After analyzing the statistical data by MATLAB, the following graphs for different curve types were obtained, and it showed that the brace's pressure is affected by changes in body postures, curve type, degree of Cobb angle, patient details, and mostly the time of brace wear. And also it showed sleeping position have affected the pressure changes mostly than other activities regardless of the curve type. So we can conclude in this research that with the correction of scoliosis deformity, we can determine the reduction in pressure at the pressure points, resulting in arriving at an objective decision on curve progression and the need to redesign a brace. The use of this device could help to advance the field of scoliosis and in future developments. Thank you.
I'm Dr. Samranayaka and will be briefing you on our research variations in the density and distribution of Coil-like cells associated with the pathogenesis of uretropelvic junction obstruction. Coil-like cells are in the upper urinary tract. They have an ability to generate coordinated spontaneous action potentials. They are hypothesized to propel urine downwards at the uretropelvic junction. The role of Coil-like cells were put into question by researchers, demonstrating either a higher, lower, or no change in the Coil-like cell density at the uretropelvic junction between the obstructed patients and the normal controls. Therefore, our research was conducted to describe the variations in the density and distribution of Coil-like cells associated with the pathogenesis of uretropelvic junction obstruction. In our study, we compared the density and distribution at the upper urinary tract in patients with obstruction and healthy controls. A meta-analysis was performed. Our results showed a higher Coil-like cell density at the uretropelvic junction in normal subjects compared to the obstructed patients. Furthermore, the Coil-like cell density at the uretropelvic junction gradually increased with aging in both the healthy subjects and the patients with obstruction. This line diagram illustrates the rise in Coil-like cells with aging in both cases and controls. We concluded that Coil-like cell density changes contributes to the pathogenesis of uretropelvic junction obstruction. Age positively correlates with the Coil-like cell density. For further information, please read our article mentioned below. Thank you.
Everyone, I'm RN Sevandi. I'm here to briefly describe my study, Satisfaction Regarding Nursing Care among patients with dengue fever in National Institute of Infectious Disease. Dengue is a mosquito-borne viral infection and it can cause lethal life-threatening complications. According to the WHO 2018, the incidence of dengue has increased 30-fold over the last 50 years in Sri Lanka. Objectives: to assess the satisfaction regarding nursing care among patients with dengue fever in National Institute of Infectious Disease. This was a descriptive cross-sectional study carried out using patient satisfaction with nursing care quality questionnaire of 26 items among 330 patients who admitted to dengue unit at NIID. The data were analyzed using chi-square and descriptive statistic in SPSS version 23 software. Moving to the results, the mean age of the sample was 30.72 years and majority was male. Among the participants, 67.9% reported that they are satisfied regarding overall nursing care. The majority, 7.3%, were satisfied by the attention given by the nurses regarding the patient's condition. Patients' opinion regarding the number of beds and the number of patients in the ward were the main reason for the dissatisfaction of the majority. It was 82.4%. The chi-square test showed there was significant association between the length of hospital stay and patient satisfaction. It was 0.031 and available overall hospital facilities and patient satisfaction. It was 0.031. In conclusion, the majority of the patients were satisfied 67.9% with nursing care and were significantly associated with length of hospital stay, available hospital facilities. These are the references. Thank you.
Hi everyone, I am Priyadarshini. My presentation is on prevalence associated risk factors of ocular trauma among adults attending to the National Eye Hospital of Sri Lanka. Ocular trauma is a major cause of visual impairment ranging from small foreign objects, corneal aberration to complete blindness. In the most cases, it is preventable and post-traumatic complications have an impact on individuals' work performance. Age, male, gender, occupation, risk behavior, sports often to contribute traumatic ocular injuries. The study was aimed to determine the prevalence and describe the associated risk factors for ocular trauma among adults attending to the National Eye Hospital. This was a descriptive cross-sectional study carried out using interviewer-administered questionnaire among 200 patients who attended to the National Eye Hospital. The data were analyzed using descriptive inferential statistics using SPSS. The study was ethically approved. Moving to the results, mean age was 41.4 years, majority were male, married, employed, and live in urban areas. Among injuries, more than 50% were reported between 20 to 40 years old. Half of them didn't follow regular clinic follow-ups. Visual acuity has been reduced significant level after the injury according to the analysis. Most common ocular trauma is blunt injuries, it was 66%. Ocular trauma was associated with age, gender, occupation, use of alcohol, and wearing spectacles, and not associated with place of residence and educational level. Moving to the discussion, ocular trauma is mainly followed by blunt injuries, nectities, sharps, and chemicals. Trauma is associated with age, gender, occupation. Similar findings are reported in the current study also. Further, alcoholism and wearing spectacles were associated with ocular trauma. So I would like to conclude that ocular trauma typically result from physical injuries and strategies are needed to be taken to minimize the impact of ocular trauma. These are the references. Thank you.
Hello, I'm Saira Chamika and I'm here to present our undergraduate research on completion rate and polyp detection rate of colonoscopies done at Colombo South Teaching Hospital and factors influencing. Colonoscopy is a procedure done to visualize mucosa of the large intestine and terminal ileum. It has been the gold standard for detection of colon diseases for over 50 years. There are two main purposes, diagnostic and therapeutic. Completion of colonoscopies, whether the colonoscope reaches the terminal ileum, which is identified by the presence of ileocecal valve, appendiceal orifice, or by ileal intubation. Our objectives of this research were to determine the completion rate, to determine the polyp detection rate, and to identify the factors influencing this completion rate and polyp detection rate. This was a descriptive cross-sectional study which was conducted in colonoscopy unit of Colombo South Teaching Hospital. The sample size of 109 patients who underwent colonoscopy were observed, and they were administered with interviewer administered questionnaire. Results were as follows. Completion rate was 81%, polyp detection rate was 13%, mean withdrawal time of all the colonoscopies were 2.5 minutes. This was significantly different from the standard mean withdrawal time. None of the socio-demographic factors nor the patient's medical history related factors were found to be statistically significant. Conclusions were instructions on proper bowel preparation should be given to patients to their level of understanding to maximize the completion rate and the polyp detection rate. Our recommendations are to keep colonoscopy records in the hospital for at least 2 years to facilitate further research, and to do research in many colonoscopy units rather than being restricted to 1 unit. Thank you.
Hello everyone, I am going to present my research findings under the topic correlation between ultrasound-based thyroids and fine needle aspiration cytology findings of suspicious thyroid nodules and institutional experience. In Sri Lanka, thyroid cancer incidence has risen over the last 2 decades, and it has become the second commonest type of malignancy among females. Ultrasound scan and fine needle aspiration cytology are considered as the first-line investigations in the preoperative diagnosis of thyroid tumors. The study was conducted with the objective of correlating the ultrasound-based thyroid findings of suspicious thyroid nodules with thyroid cytology results. This was conducted as a descriptive cross-sectional study at Colombo South Teaching Hospital and at the Department of Pathology of University of Sri Jayawardhanapura, enrolling 71 radiologically malignancy suspected patients. Thyroid system of reporting was used to report the radiological findings, while the Bethesda system was used to report the fine needle aspiration cytology results. According to the results, 84.5% were females, where the mean age was 49.5 years. And according to the radiological findings, as we used only the radiologically malignant suspected patients for the study, all of them were belong to thyroid spore category, where 43% of thyroid spore A, 37% of 4B, and 20% of 4C. And in the subcategory 4C, all the specimens were diagnosed as papillary thyroid carcinoma according to the Bethesda system of reporting. And according to the fine needle aspiration results, 18.9% of thyroid spore A and 66.6% of thyroid spore B were diagnosed as malignant. As a conclusion, ultrasound-based thyroid reporting system, when used in combination with the Bethesda system of reporting, could identify the malignancies with high level of confidence. Thank you.
Hello everyone, I'm Chamalika Veerapal. I'm here to briefly describe my study, Association of Narrowing of the Disc Space and the Presence of Anterior Osteophytes with Intensity of Chronic Neck Pain. This is a part of my ongoing study. Even though neck pain is a major health problem and it is associated with radiological features of cervical intervertebral disc degeneration, it is not systematically studied in Sri Lanka. Therefore, the aim was to investigate the association of disc space narrowing and anterior osteophytes with intensity of chronic neck pain. We conducted this study with 358 chronic neck pain patients. What we did was we measured the intensity of pain of the patients using visual analog scale. And we measured the radiological features, disc space narrowing and anterior osteophytes on lateral cervical X-ray using AutoCAD 2012. These two formula we have used to obtain disc space narrowing and anterior osteophytes. We try to see the difference of mean intensity of pain between two groups, none or mild and moderate to worse disc space narrowing. We observed significant difference, and also we observed significant difference of mean intensity of pain between two groups, none or mild and moderate or severe anterior osteophytes. In conclusion, I would say disc narrowing and presence of anterior osteophytes are significantly associated with intensity of chronic neck pain. Thank you.
Colorectal cancer is increasing and is one of the commonest forms of cancer in Sri Lanka. While tertiary care hospitals carry out a significant number of colorectal cancer surgeries a year to improve post-operative recovery, the healthcare workers need to focus on factors associated for fast and uncomplicated post-operative recoveries. The study is a descriptive cross-sectional study comprising of 62 study participants admitted to a tertiary care hospital in Sri Lanka. A consecutive sampling technique was used. Data was collected using an interviewer-administered questionnaire containing 6 sections comprising of patient's demographic details, preoperative factors, intraoperative factors, postoperative factors, and QOR40 standard questionnaire. The QOR40 standard questionnaire was used to assess the patient-reported postoperative recovery. Factors were then cross-analyzed with the QOR40 score, and the significance level was set at 5%. The quality of recovery score preoperatively 187.74 and on the 10th post-operative day 185.11 was found to be significantly different. There was no statistical significance observed between the less than 63 years of age category, male gender, monthly income less than rupees 50,000 category, not receiving neoadjuvant chemotherapy, absence of comorbid conditions, early cancer, normal BMI, and undergoing laparoscopic surgery with the postoperative recovery. Conclusions. It was found that the patients have not fully recovered to the baseline within the 10th day postoperatively, and that the factors assessed had no statistically significant impact on the patient's recovery after colorectal cancer surgery.
Greetings to the Honorable Judge Panel. I'm Rashmi Vikramasinghe and I will be presenting on behalf of the other authors for the abstract titled A Clinical Profile of Cervical Cancer Patients Attending the Apeksha Hospital, Mahalagama, Sri Lanka. Cervical cancer is the fourth most common type of cancer affecting women globally. And in Sri Lanka, it is the second most prevalent type of cancer amongst women. The aim of this study was to identify the clinical profile of cervical cancer patients presenting to Apeksha Hospital. A total of 66 women with varying stages of the disease were recruited via convenient sampling, and data was collected from 2019 to 2021. The results show us that the most affected age group was the 61 plus age group, and a majority of women were shown to be singles. The most common type of cervical cancer was squamous cell carcinoma, and the most prevalent clinical stage was shown to be clinical stage 2B. According to the results, we can see that a large proportion of the women were diagnosed during the latter stages of cervical cancer, and a majority of them were over 60 years of age. Almost all the women in this study were unaware of cervical cancer, and this shows that there is a lack of reproductive and sexual health awareness. This could have been a reason as to why they were detected during the latter stages of the disease. As the current testing strategy, the pap smear is a routine test that should be done every 3 years depending on other risk factors. If the women in this study had undergone routine checkups, the clinicians would have been able to detect the disease during the precancerous stages and prevented it from progressing into a cancer. These reasons emphasize the need for developing an efficient screening and prevention strategy for cervical cancer. Thank you.
High serum antioxidant enzyme activity among long-term meditators. Meditation has gained much attention as a complementary treatment for various clinical modalities. Meditation has shown to have a positive outcome on oxidative stress, which is caused by the imbalance between the production of oxidants and their elimination by antioxidants. Recent studies have indicated that meditation increased several intracellular enzymatic antioxidant enzymes such as superoxide dismutase, catalase, and glutathione peroxidase. However, the outcome of Moody's meditation on all three of these enzymes collectively haven't been studied yet. Therefore, the objective of the study was to assess superoxide dismutase, catalase, and glutathione peroxidase activity in experienced long-term meditators and to compare them in an age, gender, and educational level matched non-meditating group. Participants were recruited using a validated interview, and 18 long-term experienced meditators and 18 age, gender, and educational level matched control subjects who had never practiced meditation were selected for the study. Blood was collected from the participants after 12-hour fasting, and serum and plasma was separated. The superoxide dismutase, catalase, and glutathione peroxidase activity of the meditators and controls were determined using commercially manufactured LDN ELISA kits and were compared using Mann-Whitney U-test and samples t-test. The mean age of the participants was 43 years and 67% were males. The mean duration of the meditation practice was almost 7 years. The superoxide dismutase of the meditators was significantly higher compared to the controls with a significance of 0.032, and the catalase activity of the meditators was significantly higher compared to the controls with a significance of 0.007. Glutathione peroxidase activity of the meditators were higher but not significant compared to the control group with a significance of only 0.08. The findings of significant higher superoxide dismutase and catalase activity in the long-term experienced meditators compared to the non-meditator control group suggest the potential beneficial effects of meditation in decreasing oxidative stress. This study was funded by the AHEAD grant. Thank you.
I'm Dr. Asoda Rohanachandra, and I'll be presenting the findings of an online survey on the psychological impact of COVID-19 on the general population of Sri Lanka. It is well known globally that COVID-19 is associated with negative psychological consequences in the general population. However, this has not been studied in the Sri Lankan context. Therefore, we conducted an online survey in the general adult population more than 18 years by using the depression anxiety scale and questionnaire on social demographic details and the coping strategies. We emailed this questionnaire through a commercial survey company and also posted this on social media sites. The response rate was low, with only 585 participants responding to the survey, and majority were female, Sinhalese, employed, married, and from the Western Province. Our survey found that about 30% of the participants had high levels of depression, approximately 25% had high levels of anxiety, and close to 15% had high levels of stress. We also found that depression, anxiety, and stress were all significantly higher in those who had financial loss due to the pandemic, and also in those who had difficulty in obtaining food and other essential items during the lockdown. We also found that depression and anxiety were significantly higher in those who were less than 35 years of age, unemployed, not currently married, and who had no children. Stress was significantly higher in females and those who did not have the option of working from home and had to go to work during the lockdown, and who had a past history of psychiatric disorder. In conclusion, our results were similar to the global literature in that we have found high levels of depression, anxiety, and stress in the given population, and we recommend further large-scale nationwide studies to be done in order to assess the impact to design necessary interventions. Thank you.
Hi everyone, I'm Vishwanath. My presentation is on the practice of managing common childhood injuries, a cross-sectional survey among parents with children in Battaramulla Medical Office of Health. Unintentional injuries are the one of leading cause of death in children. Falls, cuts, wounds, choking, and drowning occur more frequently. Most often those are preventable. Increased awareness and prompt intervention on managing those childhood injuries increase survival and well-being. So, this study was aimed to identify the prevalence of common childhood injuries and to assess the level of parental practice on managing those injuries. It was a descriptive cross-sectional study conducted among 200 of parents in Battaramulla Medical Office of Health. We used cluster sampling method to select preschools, and also we use self-administered questionnaire. Data was analyzed by using descriptive and inferential statistics, and study was ethically approved. Mean age of the participants 22 years or 32 years old. Majority of participants were mothers, belonged to the nuclear family, and followed the secondary education. Wounds by falling was the most common injury, and others were head impact, insect and animal bites, burns, choking, and cuts with sharps, poisoning, and fractures. Incorrect practices were observed in managing epilepsy, managing drowning and fractures, burns, and managing animal and insect bites. Also, 16% was applied tourniquet to managing the bleeding. The level of practice of managing childhood injuries was associated with the participation of first aid training program, and it was not associated with the education level and age of the parents. Falls and animal insect bites are the most common childhood injuries among preschoolers. Incorrect practices of managing home accidents widely reported, and it has been associated with the receiving the training programs on managing childhood injuries. Current study also reported similar findings. So I would like to conclude that falls are the most common childhood injuries among preschoolers. Parental practice on managing childhood injuries is very poor. Rapid strategies are need to be taken to improve in parental practice.
Good morning, everyone. I am Omelka, a nursing graduate from Coil Defense University and currently works at Navaloka Hospitals. Today, I'm going to present you on the topic Higher Awareness of Well-Women Clinic Activities and Associated Factors among patients with cervical cancer at Apeksha Hospital, Sri Lanka. Cervical cancer is the fourth most common malignancy worldwide. Nearly 1,000 cases are identified a year in Sri Lanka. Well-Women clinics are established in 1996, but over the years, the target participation was not achieved. Pap smear is an essential cytological screening tool that is available at Well-Women clinics, and there are factors that affect the participation of Well-Women clinics. Main objective is to identify the prior awareness of Well-Women clinic activities and identify the associated factors. Methodology. A descriptive cross-sectional study was carried out at Gynecological Ward and VOG Clinic at Apeksha Hospital, using 50 participants with cervical cancer and by administering a self-administered questionnaire. The result: majority of the participants were in the age group of 41 to 50 years in cervical cancer stage 2. And nearly 50% of them had the awareness of the services provided at the Well-Women clinic, but only 30% of them had attended the Well-Women clinic prior to the diagnosis of cervical cancer. Ignorance and lack of awareness were the most highlighting factors for not attending a Well-Women clinic. Prior awareness of pap smear test and Well-Women clinic participation had a significant positive correlation. To conclude with, the Well-Women clinic participation, awareness of pap smear test and Well-Women clinic services were poor among the participants, and most identified factors were due to lack of awareness and ignorance that they did not attend. So there needs to increase the awareness of cervical cancer screening programs and Well-Women clinics among the community. Thank you.
Good morning, everyone. I'm Nayanthara Gamalath presenting today our undergraduate research on the topic Factors Associated with Fertility Preferences Among Antenatal Clinic Attendees at a Tertiary Care Hospital, where we aim to look at fertility preferences and their associated factors. For this, we conducted a descriptive cross-sectional study using pre-tested interviewer-administered questionnaire on 327 systematically sampled pregnant women undergoing planned pregnancies attending a tertiary care antenatal clinic. The data analysis showed a desired age for pregnancy as 25.2 years and a mean desired number of children as 2.32. Pregnancy postponed was seen among women who highly educated, employed, long working hours and more siblings. Also, who has history of minor gynecological diseases other than subfertility. Early pregnancy was desired by women who are less educated, self-employed and has less income. Regarding desired family size, Sinhala and Tamil majority preferred to have 2 children, whereas Muslim women desired to have 3 children. Surprisingly, women with history of gynecological surgeries, history of past cesarean sections and long-term illnesses prefer to have more children. We believe these results we have shown can be used in planning and implementing reproductive health in the country. Thank you.
Title is Solid Waste Management and Associated Factors in State Sector Institutions in Jaffna Municipal Council area. Solid waste management in state sector institutions requires sustainable interventions. The objective is to assess the solid waste management and associated factors in state sector institutions in Jaffna Municipal Council area. This descriptive cross-section study was carried out in 240 state sector institutions in Jaffna Municipal Council area during September 2020 to March 2021. Institutions related to national security were excluded. Data was collected using both self and interview administered questionnaires directed towards the head of the institutions and observation checklist. Solid waste management practices data were converted into a composite score, then categorized into below median and above median. Point and interval estimate were calculated, and site test and independent t-test were used to determine the statistical significance. Ethical approval was obtained from Ethical Review Committee of Postgraduate Institute of Medicine. And results are 57% of the institutions didn't designate any officers for the solid waste management. And 21.2% of the institutions claimed that they are implementing polythene-free workplace policy. And 69.6% of the head of the institutions recognized burning polythene as a punishable offense in Sri Lanka. And on more devastating is 30.8% of the institutions were observed burning polythene. Solid waste management practices were associated with having a designated officer or team for the solid waste management with ratio of 0.4 and polythene-free workplace policy with ratio of 0.2 and knowledge of the head of the institution with p-value of less than 0.001. And the conclusion is explicit training of the head of the institutions and the focused facility improvement will improve the solid waste management in state sector institutions.
I'm Shamini Kaushala, Nursing Officer. I am presenting our research finding regarding knowledge, attitude and practice regarding breast cancer prevention among the age 80 to 65 years first degree female relatives of breast cancer patient in National Cancer Institute, Sri Lanka. Breast cancer is the most frequent cancer type among the women, and the family history increased risk by the 2 to 3 fold. An objective to assess the knowledge, attitude and the practice regarding breast cancer prevention among the age 80 to 65 year female first-line female relatives. We use descriptive cross-sectional study and interview administered presented questionnaire and random sampling method for 384 first-line female relatives in the clinics and wards in the National Cancer Institute, Sri Lanka. We use for data analysis chi-square and the descriptive statistic in SPSS version 23 software. Demographic data were 78% were unmarried, 60% were unemployed, 42% were educated up to A level, 54% were relationship to the patient is sister.
Knowledge on the breast cancer warning signs: 61.7% were change the breast size and the count, 61.3% were says nipple discharge and the firkin, 57.3% were orange pale appearance, and 52% were said nipple retraction could be the symptom of the breast cancer. And the knowledge and the attitude of the breast cancer: 26.3% were positive person know how to do the cervix examination, 83.7% performance regular cervix examination, 52.3% difference between the early and the late identification, 47% cervix examination, and clinical breast examination is early identification of the breast cancer. Conclusion: even though participants of the breast cancer signs and symptoms are satisfactory, self-breast examination was low, and there was significant relationship between the participant relationship with the patient with knowledge of the cancer sign and symptom, and between the self-performed breast cancer and participant level of the education. Thank you.
Hello everyone, I am Sudhini Pramotya, physiotherapy undergraduate of Kotalavala Defense University. Our research is effectiveness of cordyceps muscle strength in reducing falls of elderly people in two selected elders' homes in Colombo district. Background of this study: falls are considered as one of the geriatric giants experienced by all the adults at least once in their elderly stage. Our study aimed to identify effectiveness of cordyceps muscle strength in reducing falls of elderly people. In the methodology, a cross-sectional study conducted by using non-probability convenient sampling method. As our study setting, we chose two elders' homes in Colombo district. They were Selina Alvis Elders Home and Sahanude Elders Home. As our sample size, we selected all 60 elderly people who completed inclusion criteria. Cordyceps muscle strength was evaluated by using modified Spic manometer test. Fall history was assessed by using interview administrated general information sheet. Under the results of our study, you can see in the table mean values of average cordyceps muscle strength between falls and non-falls group of elderly people. According to the independent sample t-test, a significant difference of means was found in average cordyceps muscle strength among falls and non-falls group of elderly people. The results concluded that deprivation of cordyceps muscle strength directly affects the falls in elderly people. To maintain the good cordyceps muscle strength, as physiotherapists, we can introduce various exercises to the elders. Thank you.
Hello, I'm H.H.N.D. Dhamratna. On the behalf of my research team, I'm going to share our findings with you. The title on Knowledge and Practice on Infant and Young Child Feeding Practices among mothers who work as nursing officers at selected hospitals in Sri Lanka. Undernutrition is associated with 45% of death worldwide. Child feeding may challenge for a mother who work as a nursing officer with the nature of profession. Therefore, we have conducted a study to identify knowledge and practice on infant and young child feeding practices among mothers who work as nursing officers at selected hospitals in Sri Lanka. This is a descriptive cross-sectional study conducted at the Soisa Hospital for Women and Dr. Neville Fernando Teaching Hospital. Data were collected from 120 nursing officers having at least one child within 6 months to 10 years old considered as inclusion criteria. Purposive sampling method was applied to select the study sample. Researcher developed pre-tested questionnaire was used for data collection. Data were analyzed by performing descriptive statistics. Most of the participants were belong to the age 30 to 34 age group, and majority of the participants educated up to diploma level. And most of the families consist with one child, and 30% of nurses who are having children below 6 months had reported to the work. So when it comes to the infant and young child feeding practices among the participants, the prevalence of exclusive breastfeeding practices was 81%, and 19 had given complementary feeding before 6 months. In this chart, you can see what are the common reasons for early initiation of complementary feeding. And from the participants, 42 and 35% added salt and sugar respectively when preparing the complementary feeding. Majority of the nursing officers had good knowledge of infant and young feeding practices, but still there is a need making adjustment in complementary feeding practices. Thank you.
Samira Teja Nalapatha from the 27th batch, Faculty of Medical Sciences, University of Sri Jawatanpura. And our topic is factors associated with knowledge of school teachers on conduct disorder in selected schools in Sri Lanka. So conduct disorder is one of the most common psychiatric disorders among children and adolescents in the world. Therefore, it is very important for teachers to have an adequate knowledge regarding the disorder. So our main objective was to describe the socio-demographic and teaching experience related factors associated for knowledge of school teachers on conduct disorder in Nugegoda in Moich area. So we did a descriptive cross-sectional study comprising of 188 participants. Knowledge on etiology and clinical features were assessed and categorized using a validated scoring system into good and poor knowledge categories. So we did a snowball sampling because of the prevailing country situation. Data was collected using a self-administered questionnaire, which was used as a Google form. Good knowledge was defined as more than 50% and poor knowledge was defined as less than 50% from the total score. So among the study population, 111 knew about conduct disorder. Among these 111, 29 were in the good knowledge category and 82 were in the poor knowledge category. A significant association between high level of education and good knowledge was found. So conclusions are the majority of teachers had knowledge on conduct disorder to some extent, but the scope of the knowledge was not adequate. So therefore, continuous professional education should be introduced. Thank you.
Hello everyone, I am Ushani Taruka, a postgraduate student from Faculty of Medicine, University of Peradeniya. Here I am presenting my research study titled Type of Support Women Who Experience Domestic Violence in Sri Lanka, born from healthcare professionals, women's preferences and expectations. Domestic violence has recently become a global public health problem. As a formal support service, healthcare professionals could potentially play a major role in responding to domestic violence. Therefore, this qualitative study was aimed to explore type of support that women would like to receive from healthcare professionals in order to improve healthcare professionals' response to domestic violence. Study participants were women who experienced domestic violence and they were recruited from gender-based violence centers using maximum variation sampling techniques. In-depth interviews were used to collect data and data analysis was done using thematic analysis. Major themes that emerged as expectations from the healthcare professionals were mediation of the problem, instrumental support, exert personal qualities, provide general health care, and provide emotional relief. Majority of women wanted healthcare professionals' mediation to keep the family together and to change the perpetrator's abusive behavior. Expectation of financial and instrumental social support to find a job, a place to live, and to educate their children were expected by many women. Women also expected referrals to other support services. Many women expected healthcare professionals to be confidential, empathetic, to listen and pay more attention about domestic violence when discussed. Some women expected emotional support. Some women wanted general health care services such as medical assistance for the perpetrator. This study concluded that women facing domestic violence expect psychological, social, financial, medical and instrumental support from healthcare professionals. Finally, this study recommends a multi-sectoral approach including a proper referral system between health and other sectors. Thank you.
My warmest greetings to everyone. I'm Ms. Dhanija Mrugadas and I would like to present my paper on knowledge and practice on the usage of skin whitening products and the associated factors among the undergraduate students of University of Vietnam, Sri Lanka. Skin whitening products, also called as skin whiteners or the brighteners, are commonly applied over the skin to treat medical conditions and also to brighten the skin. The combination of the active ingredients present in this formulation could bleach the skin and also causes side effects on long-term usage. Our study aimed to assess the knowledge and practice of the undergraduate students on the usage of these skin whitening products. This is a descriptive cross-sectional study which recruited 360 students on the basis of stratified random sampling method. A validated self-administered questionnaire was used to collect data, and a predetermined cutoff value of 50% was used to categorize the knowledge as good and poor. Majority of our study were females and belonged to the group of non-health related causes. We found around 2/3 of the students have used these skin whitening products in their lifetime, and surprisingly, 62% of them had poor knowledge on this usage. More than 3/4 of the students have started using these products without getting proper consultation from the healthcare professionals, which led 50% of them to experience side effects. And also we found statistical significance between the course of study and the level of knowledge, also between gender and the product usage. In conclusion, our study strongly suggests for the requirement of the greatest awareness among the youngsters on usage of these skin whitening products in order to eliminate unnecessary complications.
I am Pubudu Kodipili from the 26th batch of the Faculty of Medical Sciences, University of Sri Jayawardenepura, and our research topic is knowledge on selected cancers, attitudes towards screening of these cancers, and associated factors in women attending antenatal clinics at a selected MOH area in Colombo district. Breast and cervical cancers are two of the commonest cancers affecting the woman in the world as well as in Sri Lanka. Screening tests are available for early detection of these cancers, which result in good prognosis. Attending to these tests depends on the level of knowledge and attitudes towards screening. The antenatal population, which represents different socio-demographic platforms in the community, is expected to reflect the overall knowledge and attitudes of female population in Sri Lanka. A descriptive cross-sectional study was conducted on a sample of 84 mothers attending antenatal clinics in Kahatude MOH area. A pre-tested interview-administered questionnaire was used to collect data. The level of knowledge and attitudes are categorized into good, fair, and poor according to the marks obtained for the statements given in the questionnaire. Study revealed that majority of the participants had a fair level of knowledge in breast and cervical cancer, and majority of the study participants had a good level of attitudes towards screening of these cancers. The most poorly answered statements regarding breast cancer include early menarche and late menopause as risk factors, hormonal therapy as a treatment modality, and scaliness of the breast as a sign. Most poorly answered statements regarding cervical cancer include human papillomavirus infection as a risk factor, awareness on HPV vaccine, and the use of this vaccine to prevent cervical cancer. Significantly associated factors with knowledge are age, duration of marriage, studying bioscience or A-levels, education level of the spouse, previous admission to gynecology wards, presence of known person with breast or cervical cancer, printed source of knowledge, gravidity, parity, income, and leisure time. The only significant association with the level of attitudes towards screening is the level of knowledge on breast and cervical cancer. In conclusion, the overall results are satisfactory. However, improvement on aspects the participants are less aware of by implementing suitable strategies is emphasized. Thank you.
Hello everyone, I am Prabhas Sirivardhana. In this study, we attempted to explore the barriers faced by healthcare professionals during their clinical consultation in the identification and management of domestic violence, which is one of the major health and social issues in Sri Lanka. For that, we conducted 19 semi-structured in-depth interviews with purposefully selected healthcare professionals from the Kandy district. As shown in the figure, we identified 6 major themes from the qualitative thematic analysis. As we identified, their major barriers, their lack of training and knowledge toward domestic violence management. Under this theme, they said that they do not know how to ask about domestic violence, where to refer them, and also how to provide a valid response to women who experience domestic violence. The second important barrier expressed by the healthcare professionals is that their lack of time to build up a trusting relationship and make in-depth inquiries about domestic violence within limited time frame. They pointed out that they can allocate around 5 minutes per patient in their overcrowded outpatient department. They also reported that they had to do many of the other works in their ward settings. Regarding the third theme, some healthcare professionals believe that domestic violence is a private family matter and it is not a medical problem. They further emphasize that domestic violence is an expected part of the family life and not the responsibilities of the healthcare professionals. The fourth theme regarding the safety concerns toward their involvement in domestic violence management. They highlighted that after providing some service to women who experience in domestic violence, they may have to face some threats from their husband. According to the fifth theme, we have identified their lack of resources such as limited staff and safe private spaces to conduct confidential consultation as another barrier. Finally, almost all the healthcare professionals reported that most of the women who experienced domestic violence were unwilling to disclose their abuse, as they wanted to protect their families despite the domestic violence experiences. Consequently, healthcare professionals were discouraged in identifying and providing appropriate help in situations where women remain silent about the domestic violence experiences. So, these findings concluded that culturally acceptable training intervention required to improve the healthcare professionals' knowledge and skills toward domestic violence management. Thank you.
Hello everyone, I'm Hansiji Samarakudi representing Group 11 of 26th Batch Faculty of Medical Sciences, University of Srijavadanapura. Our research topic is Barriers for School-Based Comprehensive Sexuality Education among Teachers of International Schools in Sri Lanka. We chose this topic because there are many controversies existing regarding the delivery of comprehensive sexuality education. Therefore, studying teachers' perspective is important. Our main objective was to describe the perceived barriers to provision of school-based CSE among the teachers of international schools in Colombo district. Methods and materials. A cross-sectional descriptive study was conducted using a self-administered online questionnaire with convenient sampling of 170 teachers. 15-item questionnaire assessed the perceived barriers, while support was assessed with a 5-item, 5-point Likert scale and dichotomized as good and poor using median split. Data analysis was done using SPSS version 15.0. A p-value less than 0.05 was considered significant. Main results. Majority regarded the support they received from the school and the society as poor. Lack of preparedness of the country's education system, time limitations, and culture or religion were perceived as barriers in CSE provision. Finally, in conclusion, lack of preparedness of the country's education system, time constraint, culture or religion, and certain terminology and topics in the CSE curriculum are reported as barriers for provision of CSE. Thank you.
Impact of COVID-19 and lockdown process on first dose of MMR and J vaccines in a selected MOH area in Colombo district, Sri Lanka. With COVID-19 pandemic and lockdown process in late March 2020, national immunization program was halted for 1.5 months. The most affected vaccines were first dose of MMR and Penta vaccine globally and JE vaccine locally. Hence, we analyzed the effect of COVID-19 and lockdown on timely coverage of first dose of MMR and JE vaccines in a selected MOH area in Colombo district. It's a comparative cross-sectional study where anonymous data was used from the Part B of immunization record to compare immunization during first 6 months of 2019 and 2020. In 2019, there were 318 children eligible for MMR vaccine, while in 2020, there were 271 eligible children for MMR vaccine. Out of them, in 2019, there was a 4.1 delay, and in 2020, there's a 22.1% delay, which is significant. When we take the JE vaccine, during 2019, there were 305 children eligible for JE vaccine, while in 2020, there were 269 eligible for JE vaccine. Out of that, in 2019, J vaccine was delayed among 4.9%, while it was delayed in 21.6% during 2020, and the statistically significant. The mean duration of delay was 15 days in 2019, and when compared to 2020, it is 18 days. We conclude that complete lockdown process has significantly affected routine MMR first dose and JE vaccine and need to be vigilant on recurrence of these infections in the community. Thank you.
Hello, Devindi. Today I will be presenting on prevalence of selected menstrual abnormalities and its association with body mass index and other associated factors among female students of selected university. As we all know, menstrual disorders are the major gynecological problem among young women. According to literature, factors such as BMI, exercises, stress level, and age at menarche can be related to it. In Sri Lanka, prevalence of menstrual disorders and associated factors among university students are still under research. Therefore, my primary objective was to determine the prevalence of selected menstrual disorders and factors associated with the selected menstrual disorders among female students of a selected university. A descriptive cross-sectional study among conveniently selected 100 female students from the 5 faculties of selected university with stadiometer, digital weighing scale, and self-administrative questionnaire to collect the data and to analyze the data. I used descriptive statistics and chi-square test in SPSS version 20. With the data analysis, we found the premenstrual syndrome was the most commonest menstrual disorder. It was 66%. When we consider about the factors associated with the menstrual disorders, BMI was significantly associated with the premenstrual syndrome, disturbance of the frequency and duration of the flow. And exercises were significantly associated with the premenstrual syndrome, but there was no any significant associated with the age at menarche with any menstrual disorders. We concluded our study as premenstrual syndrome was the commonest menstrual disorders among female students of selected university. BMI and physical exercises are significantly associated with some menstrual disorders.